This is a community health message for our neighbors across Florida, especially right here in Pasco County. Starting March 1st, thousands of Floridians living with HIV may lose access to life-saving medications due to changes in state eligibility for the AIDS Drug Assistance Program, also known as ADAP.
More than 100 people rallying on the steps of the historic Capitol today in Tallahassee, urging lawmakers to put more money in the AIDS Drug Assistance Program. Starting the 1st of March, Florida's Department of Health will cut about 10,000 people from this program to save $120 million. The state says that's because of skyrocketing insurance premiums and federal cuts to a grant used to fight HIV and AIDS. But some state lawmakers say the state can afford it. Our Capitol Bureau reporter Cody Butler will share their perspective coming up tonight.
For many, these medications aren't optional. They are the difference between staying healthy, staying undetectable, and staying alive. When treatment is interrupted, it doesn't just affect one person, it impacts families, workplaces, and the entire community.
Talk to community about what the better solutions are and see if there's any other pathway out of this.
A note on the state's AIDS Drug Assistance Program webpage outlines changes coming to the program. Only people at or below 130% of the federal poverty level qualify. For an individual, that's just over $20,000. Previously, people at 400% of the federal poverty line qualified. That person makes more than $62,000, effectively cutting 10,000 people out of the program.
The numbers are going to climb, as people lose access to their HIV medications. Not only is the community viral load going to increase, but the individuals who are going to have to stop taking medications.
Fox 13 obtained copies of 2 letters sent to people who were just terminated from the program. This is one of them.
They're canceling people's health insurance policies by the way the letter is written. They have no authority to do that for those that they're paying the premium.
Florida Surgeon General Joseph Ladapo acknowledged the seriousness of this cut in a committee hearing on Wednesday.
It's a very real and consequential issue that we're dealing with.
The Florida Department of Health said the move is to prevent a shortfall of $120 million.
Exponentially increasing in cost due to changes at the federal level, specifically related to the federal tax credits for Affordable Care Act, ACA health plans.
Those tax credits expired on December 31st. Last week, the House voted on a plan to extend the credits for 3 years.
And in this first full week of the new year, House Democrats, every single one of us, joined by 17 Republicans, have partnered in a bipartisan way to protect the health care of the American people.
But now its fate is uncertain in the Senate.
Obamacare has been a disaster, and I think doubling down on the things that haven't worked isn't the answer.
And while the fight at the federal level continues, here on the state level, Ladapo says there are not enough resources to keep everyone enrolled.
With additional resources, it would be possible to fill that gap, but with the resources that we currently have, we're unable to fill that gap.
With limited solutions on the table.
So that placed us in a position where we needed to make some changes. So the team has been literally tirelessly trying to figure out a solution, and they've explored multiple solutions. So we've had conversations with Health and Human Services at the federal level to try and figure out how we can retain the 30,000 patients with HIV. We have had conversations with other states. We've had conversations with our local stakeholders.
We want to be clear. Do not stop your treatment. Help is still available. Community organizations, healthcare providers, and advocates are working right now to help people navigate these changes and find alternative resources. If you or someone you love is living with HIV and is worried about medication access, reach out now. Ask questions, get support. HIV care is public health. HIV treatment is prevention. And our community is stronger when everyone has access to the care they need. You are not alone, and help is closer than you think. Need help navigating HIV care changes? MACA is here. If you or someone you know is living with HIV and is concerned about losing access to medication or services, do not wait and do not stop treatment. MACA, Minority Alliance for Advocating Community Awareness and Action, provides HIV education and awareness, resource navigation and referrals, support for individuals impacted by changes in care access, community-based advocacy and outreach. MACA works directly with clients to help identify available options, connect with providers, and reduce barriers to care, especially during times of policy change and uncertainty. Reach out, ask questions, get connected. Your health matters, your life matters, and your community is here to support you.